Country C106.1, Miss Barbara Mandrell. Keys in the mailbox. Good morning. Your bud Doug Owens on this side of the console. On that side of the console, as promised, our good friend Dr. Alex Rodewald with Kessinger Specific Chiropractic at 1424 Curry Lane in Cape Girardeau. They always remind us of how smart our bodies are and how our bodies can heal themselves. And Dr. Alex, welcome to the studio. Happy Army Birthday and National Flag Day today.
Yeah, happy to be here.
It's a wonderful day. And
it is.
Boy, you know when you say, I'm happy to be here on U.S. soil,
yeah,
it's such a great feeling.
It is.
Because we are so blessed in this nation.
We are very blessed.
And we're very blessed to have people like you helping us to get ourselves back on track with whatever ails us. Because as you've mentioned before, as I mentioned a moment ago, we have smart bodies. We can allow them to heal themselves with your help, of course.
We do, yeah. Our bodies can heal themselves. They heal all the time. You know, you're always going through a healing process. Whether you broke a bone or you cut your hand, it's going to heal. And the other organs in your body can heal as well, and your spine can heal. We just have to give it the means and the time to do so.
And the topic of discussion today, disc herniation. And boy, I can only imagine if you had a nickel, right, for every patient who came in with a herniated disc.
Yeah.
We don't want you to retire, though. We want you to run for a long time.
That's a nickel, yeah. I would have a lot of nickels, that's for sure. So we see a ton of people in the office with disc herniations, and whether they know it or not, some people come in and they've had a known disc herniation or disc bulge in the neck or the lower back, and they've had an MRI. You know, they've been through the process. They've gone to their doctor. They've been on pain medications. They've had injections in the spine. They've had MRIs, multiple MRIs sometimes, documenting a disc herniation. And some people come in the office and they have a brand new disc herniation. You know, it happened yesterday, or it happened this past week, or whatever it may be. And some people just come in with back pain and they don't really know what's going on, and it's our job to figure out why that's happening. And a lot of times it can be an irritated disc or disc bulge or disc herniation, causing them to have back pain or neck pain. And if you have a disc bulge or disc herniation, if it's bad enough and it's put pressure on your nerves, you can have pain shooting down your leg and your foot, even in your hands, numbness and tingling, stuff like that. And if you leave it there for long enough, you can start to lose muscle mass and strengthen your leg or arm. And so that's what we like to look at. That's what we like to examine. And we don't like when people have those types of issues, but there's a lot of things we can do to help them through that.
And Dr. Alex, I was thinking about that pain scale. You know, you often ask patients on a scale from 0 to 10, or is it 1 to 10, something like that?
0 to 10, yeah.
How you're feeling today. And with disc herniation, you're going to have some sort of pain, if not a little discomfort. But I guess it all depends on, at the onset of the disc herniation, how much pain you're going to have.
Yeah, it all depends on the person. Everybody's different. Everybody's spine is different. Everybody's nerve system is different. The holes where the nerves come out of, some people's are big, some people's are small. So one person can have a disc herniation and maybe have some discomfort, a little bit of pain, some tightness, things like that. And one person can have a disc herniation the same size and have debilitating pain. You know, I can't walk straight. I have to lean over to the side. I have pain shooting down my leg, that type of thing. And so we look at the spine in a way that kind of keeps out drugs and surgeries and things like that. We like to keep people from having to have that type of stuff. And we've seen people in the whole gamut of things. People who, like I said, have what we'll call an acute disc herniation that's very new, just happened recently, and they haven't been anywhere else. And then we've had people who have been other places. They've maybe been through physical therapy. They've maybe been to other chiropractors. They've had pain medications. They've had injections, and we can help people on all these different spectrums to a degree, depending on how bad things are.
And you had mentioned a moment ago about the pathways through the bones, the vertebrae, what have you, where the nerves pass through. And those vary. Now, is that just like part of who you are, or is that something that changes and may get worse as you get older?
It is somewhat part of who you are, and yes, it can change and get worse as you get older. There's a thing called stenosis, which is there's basically a hole where your nerve comes out of your spine, and there's a hole where the whole spinal cord runs through. And stenosis is a fancy word for that hole is closing down, and it's kind of compressing on those nerves or bundle of nerves. And sometimes that stenosis is due to just inflammation. Sometimes that stenosis is due to a disc protruding into that space. Sometimes it's due to bone spurring and old degeneration that's been growing for years. So we can assess which one is causing the issue to happen based on our x-rays, based on any imaging that people have had elsewhere, MRIs, things like that. We can look at those as well to figure out why they're having all this pain. And like you mentioned, the scale, 0 to 10, some people with disc herniations are at a 10. They have a pressure on a nerve type of pain is described as like a shooting, knife-like. It's a descriptive word that we use, that people use. And so some people tell me it feels like a knife is stabbing me in the back. And so that doesn't sound like a very pleasant, feeling there. And so we like to figure out why that's happening and what we can do about it.
It's coming up on 9:22. Your bud Doug here. Thank you so much for listening to your hometown radio station, the Cousin Carl station. Dr. Alex Rodewald from Kessinger Specific Chiropractic in the studio, as he is every Thursday at 9:15 for another great Health Talk Thursday. And today's topic is disc herniation. And Dr. Alex, what do some of the procedures entail for someone who suffers from disc herniation?
So first and foremost, as anybody who comes in the office, we have to figure out why, what's happening, where's the pain, how long's it been there, where's it shooting to, is it radiating down your leg? So we can kind of get an idea of, what type of diagnosis we need to do, what type of exam we need to do, how bad things are, and then we do our exam process, and there's tests that we can do to test for a disc bulge or disc herniation. And then we'll do x-rays for sure on a person like that to see what's going on. And like I said, we can look at any imaging they had in the past, an MRI, a CT scan, whatever it may be. And then we start with our adjusting procedures, to realign vertebrae, to get things back to where they're supposed to be so that we can balance the spine out. Because if the spine's not balanced, no matter what we do, things aren't going to get much better. And then also one thing specific for lumbar disc herniations and we have is a decompression unit. A lumbar decompression unit, which we have on site, and we've had people who have been told they have to have surgery in 2 months. The surgery's already scheduled, and we get them in the office and we start doing our procedures and adjusting and decompression, and we can keep people out. We have had many people out of surgery because of that, and so those are really the main things that we would do as far as a disc herniation goes.
And you had mentioned in one of our past conversations about a man who was scheduled for surgery, came in to see you. He didn't have to have surgery after that.
He didn't have to have surgery, and he had, on his MRI, we measured the disc herniation, how far it had pushed back into the nerve space, and it was one of the worst ones that I'd ever seen. And like I said, some people's spaces are bigger, some people's are smaller, so it affects people in different ways. But this particular person, we were able to have him. He wasn't doing perfect, but good enough to have in his mind to cancel that surgery within a few weeks, actually.
And I can't help to wonder if he heard back from his doctor.
Well, I hope his doctor was pleased, because we work with neurosurgeons. We send people to neurosurgeons to get assessed, to get evaluated. And a lot of the ones that we use, they tell us, we meet with them, we talk with them, and we learn more about them, and they tell us that they don't want to have to do surgery on people because it tends to make people either doesn't fix the problem, or it does for a little bit, maybe a year, maybe 6 months, and then it typically tends to come back, or other issues arise because of the surgery. And so they don't want to have surgery, so they like when we can help people through this process without drugs or surgery.
And with that being said, you've mentioned this many times in the past, there are 5 words that you want to knock out of your vocabulary when you feel like you're kidding yourself, right? And those 5 words are? Maybe
it will go away. Yeah, or I thought it would go away. We hear that all the time.
Doesn't quite work out like that.
They come in, they've been having this pain for a year, and I thought it would go away. And so, typically, if you're in a disc herniation situation, typically that won't just go away. The pain may lessen, the pain may decrease, but that disc is still going to be injured, it's still going to be there, and it may cause havoc down the road. And so we want to get things back as good as we can get them so that we have better outcomes into the future.
And what better way to do that than to take advantage of a wonderful special that you've been offering for quite some time now. You're going to do it again today?
That's right, we're going to do it again today like we've done in the past. We do our exam, our consultation, and our x-rays in the office if we need to for usually $180 or so, but we want to offer that to anybody who wants to call in today for $27.
And like we mentioned in the past, that is such good peace of mind, a great peace of mind, because when something happens, you automatically think, how much is this going to cost me?
Right, and when it comes to a disc herniation, there's ifs in there, if we can help somebody, stuff like that. So we want to make a definitive assessment of that person, a full assessment of what's going on, so that we can for sure tell them, we can make this perfect, we can get it back to normal, or we can help it a little bit, or maybe there's really nothing we can do, and we can tell you at that point.
$27. That's a great special. You owe it to yourself, and I can't help to wonder if anyone's ever come in and asked you, Dr. Alex, just charging me $27, how are you able to keep the lights on? But it's a wonderful thing that you offer to the community, and a big savings, and that's great peace of mind. So for a very small fee, $27. I mean, like you said, something that's normally about $180, you can get it for $27 today, and all you've got to do is give them a call or stop by the office at 1424 Curry Lane in Cape Girardeau. They're off Kings Highway, across the road from Ford Groves, behind the Ford Groves Body Shop, across the street from McCombs Funeral Home. And their phone number, here's your magic number, 573-334-0100. That's 334-0100. And as always, if you call in late today or stop in late today, as long as it's today, you'll be able to, if you're not able to see them today, you'll be able to honor that special at a future scheduled appointment, right?
Yeah, that's right, whether it's tomorrow, next week, or a month from now.
Good deal. Thank you again, Dr. Alex, for offering the special. Give the staff our very best, and tell your wife Tanya and your little girl Elizabeth hello. Give her a hug from us and a kiss on the forehead. How old is she now?
She'll be 9 months this week.
Boy, baby changes everything, right?
That's right. Yeah.
If only they could change their own diaper.
We're working on it.
And we want to thank folks who tuned in on Facebook Live today. We appreciate that. So thank you, folks, and have a wonderful day. Dr. Alex, is there anything else you want to add before we wrap it up?
No, like you said, don't let it sit around. It probably won't get better. It typically just gets worse. So get checked out for sure.
And that does it for another great Health Talk Thursday at Pure Country C106.1. Thank you, Dr. Alex. Have a wonderful day. God bless.
Thank you, Doug.